Hello, welcome to the Vibrant America Urinary Hormones Walkthrough video. My name is Dr. Julie Holdbright. I'm a clinical lab educator at Vibrant America and a naturopathic doctor in private practice where I specialize in conditions associated with gut, hormone, and metabolic disorders. Why Vibrant Urinary Hormone Testing? Urinary hormone testing is a comprehensive evaluation of urinary levels of steroid hormones and downstream metabolites, 4-point diurnal free cortisol, free cortisone, and melatonin, 8-hydroxydeoxyguanosine, a marker of oxidative stress and DNA damage, and BPA, an endocrine disruptor found widely in the environment. By measuring the full steroid pathway of hormones and metabolites, we can infer situational factors related to genetics, environment, nutrition, and inflammation that influence hormone pathways, enzymes, and metabolite production. Hormones and hormone metabolites may bind hormone receptors to initiate a physiological response, so it is important to know both. Metabolites are measured only in urine. Serum and saliva testing measure parent hormones, but not metabolites. This makes urinary hormone testing a powerful tool for understanding a patient's clinical presentation and developing effective treatment plans. The 4 samples used for 4-point diurnal values and pooled daily averages is an alternative to 24-hour collection. This is a non-invasive collection method that allows your patient to successfully complete the collection process. Urine hormone testing is completed by the patient. Your patient will collect 4 samples over the course of a day and mail them directly to the lab. No lab visit or needles are required. This is nice because even the act of a blood draw can stress the body to raise cortisol. Lab analysis is quantitative. Measurements are made using liquid chromatography, mass spectroscopy, and gas chromatography, mass spectroscopy. A comprehensive report with 57 combined markers and ratios is generated with reference ranges from the 2.5 to 97.5 percentile. It is important to prepare for collection day prior to the day of collection. Some pre-test considerations are the day of the month that you want your patient to collect. For women who are menstruating, we usually recommend collecting mid-luteal phase. And for a 28-day cycle, this would be day 19, 20, or 21. It is important to consider whether or not your patient is taking medications, supplements, or hormones, and whether you are testing baseline or treatment levels. Consider the activity and diet for the day of collection. Are you looking at a typical day, or is there an intervention that you are monitoring? And it is also important that your patient is aware that they need to collect at 4 different times during a day. The first collection will be immediately upon waking before any activity takes place, a second collection 2 hours later, a third collection in the evening before dinner, and a 4th collection at night before bed. Once you've made a decision to run a urinary hormones profile on your patient, you will provide them with a kit. You can either provide them the kit in office or have the kit sent directly to your patient by ordering it through your provider portal. These instructions are included in your patient's kit. It is important that they follow all collection instructions, including preparation, in order to ensure accurate results. Collection must be at the appropriate time and collected in the color-coded tubes corresponding to the correct time of day. Tubes should be labeled according to the instructions with their name, date, and time of collection. All of this will be sent back to the lab along with their hormone questionnaire. The color-coded tubes look like this. Blue is for the waking sample, yellow for 2 hours after waking, green for the evening before dinner, and red for at night before bed. The hormone testing questionnaire and medication list is included in the patient's test kit. Your patient must fill this out completely and accurately in order to optimize test interpretation. Patients will sometimes leave answers blank if they do not know the answer to a question, so you may need to provide some of this information to your patients. Make sure your patient includes this with their samples when they send everything back to the lab so that this information can be populated into the body of your report. The first page of your report is a summary of findings and the questionnaire data. The summary of findings summarizes all analytes that are out of the reference range in the first column, shaded in red. To the right of that, we populate the previous values from any prior urinary hormone testing for quick reference, and the reference ranges that are adjusted for menstrual status and sex. You will be able to start the process of putting together the patient's case just by looking at the summary. The questionnaire data and medications information is provided by your patient, and they will provide this by filling out the hormone questionnaire included with their kit and returning it to the lab with their samples. It's important that they send this back with their samples so that we can populate the information into the body of the report. The information is important in the interpretation of hormone levels. We report body mass index, for example, and in humans there's a correlation between increased body mass index and an elevated level of aromatase. This is an enzyme that converts testosterone to estrogen in both men and women. So if a patient has a high BMI and high estrogen, we might determine that increased aromatase activity is the root cause. Also important is information like the date of last menstrual period, whether there are any prostate symptoms, whether a patient is breastfeeding, and whether a patient has intact ovaries. Again, all of this information gives you an opportunity to have an at-a-glance overview of all of the analytes that are out of the reference range and some of the influences that might affect hormone levels. The next page of your report is the diurnal graph data for the free cortisol, free cortisone, melatonin represented by the melatonin metabolite MT6S, and creatinine. This is the only place on the panel where we measure the level of a hormone in all 4 samples. This is done because these hormones are produced in a predictable diurnal pattern. These are presented with your patient's levels superimposed over the green shaded reference range. For the rest of the samples on the report, we provide pooled values from the 4 samples. This will be seen later when we look at the parent hormones and the metabolites. Creatinine is not a hormone. It's used in hormone testing, however, to normalize values to adjust for concentrated or dilute urine. Cortisone is the deactivated form of cortisol that circulates in the body. It's also found in the urine normally in a diurnal pattern. A diurnal rhythm is a biological rhythm that is synchronized with the day and night cycles. The diurnal rhythm of cortisol and melatonin production is regulated by the circadian pacemaker located in the brain. Under certain physiological, biochemical, environmental, or stressful circumstances, the pattern may change. The HPA axis with cortisol as its final output may be activated or suppressed. Pineal output of melatonin may shift, and you can see this reflected in your patient's diurnal values for these hormones. Disturbed diurnal patterns of hormones are associated with a diverse range of illnesses, including adverse influences on brain function and cognition, heart physiology, reproduction, metabolism, sleep, diabetes, and cancer. So catching disturbed diurnal rhythms early through urinary hormone testing can be a great path to prevention. On this slide, you have a summary of each section that appears throughout the complete report. Each section is separated by comments for any out-of-range analytes. We cover the levels of the parent hormones and metabolites of the urinary estrogens, the urinary androgens, DHEA and testosterone, and the glucocorticoids. We cover the metabolites of progesterone and melatonin, which have been shown to correlate with serum levels and are commonly used in urinary hormone testing. As you go through the report, each section is reported in the order shown, starting with estrogen on the upper left. Here in the urinary estrogen section, you see the three main estrogens, estrone, estradiol, and estriol, and the metabolites of estrone and estradiol. For the metabolites, included are the 2, 4, and 16 hydroxy estrogen metabolites of estrone and estradiol, products of phase 1 detox, and the 2 and 4 methoxy metabolites of estrone and estradiol, products of methylation, a phase 2 detox reaction. Again, both the parent compounds and metabolites may bind receptors and produce an effect. The Vibrant panel has the most comprehensive number of estrogen metabolites on the market. BPA is included in this section because it binds to estrogen receptors and acts as an endocrine disruptor. The next section is the androgen section, where DHEA and testosterone and their metabolites are found. This is helpful as DHT, for example, a metabolite of testosterone, is more potent than the parent compound. Metabolites of DHEA, androsterone, and etiochalanolone can be used in ratio to assess 5-alpha reductase activity. The progestogen section covers several progesterone metabolites that are useful in assessing fertility, conditions associated with estrogen dominance, PMS, menopause, sleep, anxiety, stress, and more. The next section is the glucocorticoids. This section starts with total cortisol and total cortisone, which are the hormone bind to cortisol binding globulin, and the metabolites of cortisol and cortisone. Next is the oxidative stress and DNA damage marker, 8-hydroxydeoxyguanosine. And then you have the free diurnal cortisol, cortisone, melatonin, and creatinine in line item format. We saw these on the previous slide in graphical format. The combination of free cortisol and free cortisone, the metabolites of these, the total levels of these combined gives us great insight into the HPA axis, activation or suppression, the stress response of the individual, total adrenal output, and peripheral metabolism of glucocorticoids. Interpretation of glucocorticoids is one of the more complex aspects of urinary hormone test interpretation, but all of these analytes provide the key to understanding the impact of cortisol and its metabolites on the metabolic and physiological state of your patient. Before we move on, here are some of the report comments that you will see on your report. They will be in the corresponding section at the end of the section to aid you in interpretation of any of the analytes that are out of the reference range. Here's a sample report with summary of findings and questionnaire data on the left-hand side of your screen. On the lower right is the graph data for the 4-point diurnal free cortisol, free cortisone, melatonin, and creatinine. On the upper right is the steroid hormone cascade with the hormones, metabolites, and corresponding enzymes so you can follow the pathways. Current and previous results are reported with the reference ranges. The questionnaire data indicates she is menstruating regularly, is in the luteal phase, and is taking 3 bioidentical hormones. 6 analytes are out of the reference range on both the current and previous results. It looks like some progress has been made towards the reference ranges. BPA is elevated, and BPA has been linked to developmental and health problems in children, including attention deficit hyperactivity disorder, anxiety, and depression. It's also been linked to early puberty in girls, diabetes, obesity, and heart disease. The 4-hydroxyestradiol and 16-hydroxyestrone are elevated. These are products of phase 1 detox of estrogen. With the estradiol, it is the hydroxylation of the 4-carbon on the estrogen molecule, and with the 16-hydroxyestrone, it's hydroxylation at the 16-carbon of the estrone molecule. The 4-methoxy to 4-hydroxy ratio is low, indicating low methylation activity of 4-hydroxyestradiol. The total urinary cortisol to total urinary cortisone is low, indicating total urinary cortisone is favored over total urinary cortisol. But the free waking cortisol is high. Waking cortisol is the average of the cortisol that pooled in the bladder since the last urination, so this reflects overnight values. Waking cortisol elevations are associated with pain, glycemic dysregulation, early stages of burnout, obstructive sleep apnea, job-related stress, and other conditions that elevate the HPA axis. 4-hydroxyestradiol is associated with increased risk of breast cancer, and 16-hydroxyestrone is an estrone metabolite that covalently binds with the estrogen receptors and is linked with increased cell proliferation. Highlighting a few markers, we have the elevated 4-hydroxyestradiol, the methylation ratio, which indicates low methylation activity. Here is the pathway on the steroid hormone cascade. You can follow estradiol is converted to 4-hydroxyestradiol and then is methylated to 4-methoxyestradiol. Here is the waking cortisol marker, which is elevated, and you can see it on the free cortisol graph as a point above the reference range. This demonstrates that both the hormones and the metabolites provide valuable information to assist in assessing and treating at the root cause level. We have some tools that will assist you in the interpretation of your urinary hormones report in your provider portal. This is the steroid hormone cascade. You can see that each of the categories of steroid hormone is shaded in a unique color. The progesterone metabolites are in blue, the androgens in red, the glucocorticoids in beige, and the estrogens in green, and the mineral corticoids in orange. You can find this by logging into the provider portal, looking in the education tab, and opening the hormones folder. Also in the provider portal is the urinary hormones one-pager. You can use this to educate patients on the benefits of hormone testing. Again, simply log into your provider portal, select the education tab on the left side, and look in the hormones folder. This concludes our urinary hormone walkthrough video. If you have any questions about urinary hormones and metabolite testing or other Vibrant America tests, or if you would like to schedule a consult with a member of our clinical education team, please visit us at www.vibrant-america.com. Thank you.